All right, we'll go ahead and get started this morning with our HSA and FSA webinar. Thank you so much for joining us. I know it's a very busy time on our campus, so really appreciate all of you that have taken some time to spend with us this morning to learn more about these benefits and go through this battle of the benefits. A few housekeeping items before we get started. If you do have any questions, please use the Q&A function to share those with us, and we will have some time at the end for questions. Additionally, the webinar is being recorded, so just wanted to make you aware of that as well. With that, I'm going to hand it over to my colleagues in the benefits unit, Travis Vaughn and Katie Frim, to share about these amazing benefits with you all.
Thanks for the intro, Aaron. Appreciate it. And everybody, welcome to Battle of the Benefits, where we'll be discussing health savings accounts and healthcare flexible spending accounts. And that will be presented by myself, Travis Vaughn, and Katie Frim on the benefits team. All right. So the purpose of this presentation today is giving you information to help you make informed decisions for you to be able to save money on healthcare expenses while reducing taxable income. Both health savings accounts and healthcare FSAs can help you to achieve those goals. Throughout this presentation, we hope to highlight benefits and important differences of these plans so you'll be able to choose the best plan suited for you. All right, let's get ready to roll, or as they say in the boxing world, rumble. Round one, we'll start with definitions. Round two, we'll go into when you can make changes. Round three, we'll go over eligible expenses. Round four, we'll go over pros and cons of each of the accounts. And we'll go into round five with comparisons of different items from those accounts. And final round, we'll go into next steps, going into some upcoming presentations and upcoming other things that you'll want to put on your calendar. Please do note, CSU can't provide tax advice. For assistance with your personal tax situation, definitely make sure to consult a qualified tax advisor. All right, round one, definitions. Health savings account is a tax advantage account for eligible medical expenses. In order to be enrolled and contribute to the health savings account, you have to be enrolled in a high deductible health plan for medical coverage. And while enrolled in the health savings account, you will receive employer contributions going towards the health savings account. Flexible spending account is similar, although that's an account where you can set aside pre-tax dollars for planned eligible medical expenses throughout the year. And we'll emphasize planned eligible expenses there, as in the next bullet, this plan has more use or lose rules, and we'll get into a little bit of that in future slides. Also to note, the IRS doesn't allow enrollment, or should we say contributing to both a healthcare FSA and HSA at the same time. When are changes allowed? So for health savings accounts, enrollment's going to occur automatically when you enroll in a high deductible health plan. It is important to know most of the time when you first enroll in that account number, you will likely have to take action with Fidelity or WEX, depending on your employee type, to get that account opened and set up. Typically then after that, you can make changes on the HSA anytime throughout the year, including open enrollment. On the flexible spending account, this is something that's got to be actively selected during enrollment. And every year during open enrollment, you have to re-elect into that plan. So it is an active enrollment on that one. And the annual amounts typically can only be changed during open enrollment and not throughout the plan year in most cases. What are eligible expenses for the HSA and the FSA? As you'll see on the left, there's actually a lot of overlap between the accounts. And I won't go over every item that's eligible, but most items that go through insurance, your standard copay, co-insurances, prescriptions, and items, again, that go through insurance and are processed through insurance, and items that go towards deductibles are eligible. And it is a vast eligibility list, so we definitely encourage you to visit irs.gov, hsastore.com, or fsastore.com to get a comprehensive list. Really, again, because those eligibility expenses are so vast, there's a shortened list of a lot of items that aren't typically eligible, And just to give an example of a few of those items that aren't eligible, cosmetic services would be something that's not eligible for those accounts. And then if there has to be, like, you end up incurring late fees or something like that, and then you go to pay the service later, you want to make sure you're not paying any late fee portions with those accounts as well, as that's not an eligible expense to be used on those accounts. The main difference, or few additional items you have on the eligibility list for the health savings account, completely separate now, no overlap on this one, would be COBRA premiums, Medicare premiums, and long-term care premiums and services. Okay, we'll go over what now would be considered, or could be considered, pros and cons for each of those accounts. For a health savings account, the funds roll over and there's no deadline to use those. So that just operates like a normal bank account. As you have money and funds in there, those funds are available for use. It is a pre-tax benefit. You will receive the CSU employer contributions in that account. You can pay again for Medicare, COBRA premiums, and long-term care premiums and services. If you leave CSU, those funds, I should say, remain in that account and available for you to use. A big one, and one that's a pro on the HSA versus the FSA, is the funds that you have in your health savings account. You're able to invest those in investment options that are listed on the vendor's platform. And it is tax-free withdrawals or usage of those funds towards the eligible expenses. What could be viewed as cons now on the health savings account would be you have to enroll in a high deductible health plan and be enrolled in that high deductible health plan to be making contributions towards that. And so along with that, you'll have the standard way that high deductible health plan operates, which usually results in paying, more money out of your pocket when you actually go to use the services, since you've got to hit that high deductible before the benefits kick in. Another item on the HSA is it's an account that you have to keep the receipts for yourself and hold in your own records. And with that, the IRS may audit you one day just to make sure that the expenses that you're using on that account are indeed eligible and being used as intended for the rules of that account. Along with that, if you're not using that on eligible items or using the money for other things that aren't intended for that account, you could incur penalties within that. The flexible spending account now, pros with that, that is also a pre-tax account and benefit. One differentiator on the flexible spending account is all of the funds or annual election that you'll make on that account are available on day one. And so, for example, that means if you were to elect a $1,000 annual election, you're able to use those on eligible expenses right away, and you'll just continue to have the deduction come out of your paycheck each month over a 12-month period. Whereas in the HSA, that's only going to be available for use as those funds are actually deposited, since that operates more like a standard banking account. With the FSA, that plan is available on all other plans. So you would be able to choose one of the other medical options, medical plan options that aren't the high deductible. And so that may function better for you if you have care that points you towards a medical account that is not the high deductible health plan. Also on the FSA, it's tax-free withdrawals or usage of the funds on eligible items. Some things that could be considered cons on the FSA is we mentioned in a previous slide, and we will elaborate on a future slide. Those have use it or lose it rules associated with that. And so if you don't use all the funds by the end of the plan year, basically that money doesn't automatically roll over, or the money's not available to come back to you, basically. If there's a certain amount of funds you didn't use on that account, those would be lost. Within that account also, there are not any investment options, whereas in the HSA, you do have the ability to invest the funds in there. With the FSA, there is also no employer contribution. And while you have to keep your receipts for the health savings account, with the FSA, you actually have to upload those receipts to the vendor and administrator that handles our flexible spending accounts. And you'll have to upload those for those specific services by the end of the year. And if they're not uploaded by the end of the year or through the runout period, basically you would have to pay that money back, as we wouldn't be able to substantiate if those were eligible funds are not used for that. And that would typically come out via a payroll deduction, and you would be formally notified of that if that were the case. And again, on the FSA, if you were to ever leave CSU, that money does not come with you or continue after your employment. You would have, a period of time in which you could submit claims while you were employed during that eligible time frame, although you wouldn't be able to carry that account with you after you leave CSU. That's all for me now. I'll go ahead and pass it off to Katie Frim to continue the presentation.
Thanks, Travis, for that and all that great information. Yes, I will go ahead and take it from here. We're just going to do our comparisons now between the HSA and the FSA. So starting with our contributions and rollover options. So with the HSA, there is the pre-tax through payroll that you are able to make contributions into your account. You do also have the post-tax option where you can put funds into that account as well through your bank account. In order to set that up, you would need to go through the vendor's website and get that set up, but the pre-tax is automatic deduction from your paycheck. And then for the FSA, you only have the pre-tax option. There is no post-tax availability for the FSA, so just keeping that in mind. For your max contribution amounts for the HSA, you are looking at $4,400 for a single individual or $8,750 for a family. There is a $1,000 catch-up availability if you are 55 or older. And so what this means is you are able to add an additional $1,000 into your account, respectively for single and for family. So that would be $5,400 for single and $9,750 if it's for a family level HSA. For the FSA, we don't have the 2026 numbers yet, but the 2025 amount right now is set at $3,300. There is no differentiation between single or family on that one. For your fund rollover options, you do have that for the HSA. As Travis pointed out earlier, those funds do roll over year to year, and the funds do stick in your account even after you leave employment with CSU. If you open up another HSA with another employer, you can contribute in at that point again, but you will be able to keep those funds no matter what. Whereas for the FSA, there is no rollover availability unless you are a state classified employee, in which case you do have that option to be able to roll over a partial amount from year to year. And so we'll go into a little bit about the medical plan options for each plan and then making those elections. With the HSA, it is only available on our high deductible plans. You cannot access an HSA if you are on any other plan. It is only the high deductibles. The FSA is available on all other plans. So if you are looking for a medical plan that has a lower deductible, the FSA might be a better option. But if you are okay with having a higher deductible plan, an HSA would be a great option to have as well. The HSA offers automatic enrollment. So that's at open enrollment opportunities. It is something that will roll over if you had it in there previously. You don't need to make any changes to it. Whereas the FSA, unless you want to, of course, but the FSA, you do need to do that every open enrollment period. It needs to be adjusted each time and it needs to be selected each time. the HSA in terms of changing your contributions. So let's say in the middle of the year, you decide you have enough money in there, you don't want to add any more, or you want to increase the amount that you're contributing into your account, you can do that at any point. Whereas with the FSA, you're only allowed to change at open enrollment windows or for specific situations like qualifying mid-years. There are some where that can be changed. It varies depending on the situation. So investing, withdrawals, and record keeping. With the HSA, you are able to invest your funds, as Travis had said earlier. You can choose between whatever investment option the vendor has to invest those funds to make money on your money, which is great, obviously. The FSA does not offer this option. It is just in there. You have what you have. It will not grow, and you just want to use it before the end of the year. And then in terms of record keeping, the HSA has, you still need to keep receipts in case of an audit. You want to make sure that all of your expenses are going to be eligible for the HSA funds. And then with the FSA, you do need to submit your receipts to substantiate those claims by the end of the plan year in order for it to be covered. If it is deemed that the purchase is not valid, then it will not count towards the funds. So important things to consider with the HSA and FSA. The HSA is a part of a high deductible plan, and it can help with balancing financial needs over the course of a calendar year. So HSAs can be great for the future. They can be great for the inconsistent expenses, whereas the FSA can be really great for consistent payments. So if you have a medical expense that is continuous, you know you're going to spend it each month, it's a fabulous plan to use for that, where the HSA, if it's inconsistent, might be a better option. Like we said before, it is a long-term savings and has investment growth, and it has a bit more flexibility than the FSA does. And then for the FSA, annual elections are available on day one, whereas the HSA, it is added into your account month by month, and it just grows that way. So yeah, each plan definitely has its own considerations, and it is all dependent on what your personal needs are, which will be best for you. We have a couple of other accounts to consider. The FSA Dependent Care Account is another one, which is specifically meant for the care of dependents, primarily under the age of 13, for childcare and other expenses as such. There are options occasionally with proof where you can have dependents over the age of 13, but there is a required disability in which that will need to be proven. You do need to be working in order to qualify for the Dependent Care FSA. If you are not working, then the dependent care is not applicable. You cannot use it. There is a max contribution amount for 2025 of $5,000, and then that is increasing to $7,500 in 2026. Full details on this plan can be found at our HR website, as well as the State of Colorado Benefits Plan website for state classified employees. And then we do have the Limited Purpose FSA. This is only available for our state classified employees. It is a specific plan for reimbursements of dental and vision expenses only. So that is no medical procedures or anything related. You retain your eligibility to contribute to the HSA while enrolled in the high deductible plan. And then there is a max contribution amount of $3,300. Again, there is more information on this plan at the State of Colorado website. And then that's it for our FSA, HSA info. We do have our open enrollment coming up for our admin professional folks. That starts October 27th and will run through November 14th. We have a benefits fair on November 4th from 10 a.m. to 2 p.m. And then we will also be offering virtual sessions for open enrollment related benefit questions where you will sign up through Calendly and you will meet with myself, Travis, and any of the other benefit administrators to discuss your upcoming questions for your benefits. You can also review our summary plan description on our HR website or the state of Colorado benefits website to get the details on any of the benefits offered for medical, dental, vision, leave, a whole slew of things. I would definitely encourage you all to scan those QR codes for Fidelity WEX and our open enrollment website. It has a lot of great information that you can go to. WEX website just has more information on their HSA and FSA plans. And yeah, that's really all we got for you today.
Thanks so much, Katie and Travis. We did have a couple questions drop into the chat that I wonder if we could just answer in live session for the good of the group. There is a question regarding the grace period for the FSA specifically. So if someone is enrolled in the FSA currently and they have expenses, but they don't get the bills for those expenses till January, say, do they have a grace period to submit those claims?
I did answer that in the chat, but yeah, for sure to elaborate on that verbally. If the plan year for you is January 1st through December 31st, and you had a service incurred within that time frame, and let's say you didn't get the bill like that example until afterward, basically you would be able to submit an expense for reimbursement directly through the vendor to get reimbursed for that, as you will have the 90 days after the end of the plan year to be able to submit that reimbursement to the vendor and still get reimbursed for that item.
Thanks, Travis. And we did have another question as well about if I have elected more than I think I'm going to spend before the end of the year for the FSA, any suggestions for maybe some more expenses that those funds could go towards to make sure that they get spent before the end of the plan year?
Yeah, for sure. So we mentioned this website on a previous slide. If you go to fsastore.com, they have a comprehensive list of items that are eligible. And so if you do approach the end of the year and you don't have, and you're not state classified, I should say, and don't have any of that rollover capability, you'll be able to purchase items to take advantage of that still and not lose that. A few very basic things that I know are eligible, for example, are like Band-Aids, first aid kits, stuff like that, sunblock. But again, there's a comprehensive list that I would definitely encourage you to go check out on fsastore.com if you do run into that scenario.
Awesome. Thanks, Travis. And just wondering where we can point folks to get more information about investing in their HSA, if that would be the vendor or where the best point of contact for them would be.
Yeah, definitely the vendor. It's going to depend on your questions specifically. But when it comes to really wanting to know the ins and outs and your full options, your vendor is going to be the best resource.
Thanks, Katie. And just one last question. If for faculty and administrative professional employees who might be considering the HSA option for next year with the HDHP, can you speak a little bit towards what the employer contribution is for that account?
Yes. So for AFAP people, you receive $500 per year. It is prorated per month. So that's what it is for AFAP.
And we did have one more question come in as well about can we have the HSA and the dependent care FSA at the same time?
Yeah, most definitely. So there's nothing that would remove your eligibility to enroll in that dependent care FSA, since that's completely separate from healthcare. And so, yes, you would be able to be enrolled in the health savings account and the dependent care FSA.
All right, and it looks like we have just one more question as of right now. if I turn 55 and 26, are there any steps I need to take to add the $1,000 contribution, additional 1,000 to my HSA, or will that happen in the system automatically?
I believe you would need to upgrade personally. How that's going to work, I'm not sure since we will be moving to Workday. I think it's automatic, if I'm understanding correctly, where you can up your annual contribution amount to that, to include that extra $1,000 per year.
Yes, you will need to actively change your election though if you do want to contribute up to that $1,000.
All right, I'm not seeing any more questions in the chat. Doesn't look like any more are coming in. We can hang tight a few more minutes just in case anyone has any other lingering questions. Otherwise, we'll probably wrap up pretty quickly here, pretty soon. Thank you again for all of you who attended with us this morning. We really appreciate your time and commitment to learning more about the benefit offerings here at CSU.